Now, ankle mobility is super important for activities like squatting, lunging, and running. If we lack ankle mobility, we're really going to find it hard to get into the right position for a lot of exercises. It also is the first major joint that comes in contact with the ground when we're doing activities such as running. So it's important to know what the standards are and where you're at to know how to modify your exercise and get back to full activity. So what we're going to test today are two parts of ankle mobility, dorsiflexion and plantar flexion. We'll go through the standards that you need to achieve throughout each, and we'll also give you a couple of easy ways to test at home by yourself. So first up, we'll kick off with plantar flexion. Now that's pushing the toes away from ourselves. Simply, we're going to lay on our back, but I'll give you a quick explanation first. The ideal range is 20 to 30 degrees. Sorry, the acceptable range is 20 to 30 degrees away from that 90-degree position. So here we have 90, and we're aiming for 20 to 30 degrees. As you can see, I have heaps of range. Anything above 30 degrees is what we call optimal range. So we're simply going to lay on our back and test that. You might also notice that one foot is lower than the other. That means we've got an asymmetry in the body. Now, asymmetries are really important to look at because they increase our injury risk factor by up to about 3.5%, or 3.5 times, sorry. So if we do have an uneven side, go through the mobility section that you'll find later to make sure you try and even those sides, and then if that fails, make sure you refer yourself out to a physio for some manual therapy to try and get that as even as possible so we reduce that injury risk. Next up, we have dorsiflexion. Now we can use our dowel again here, and we're simply going to get into that half kneeling position. What we're aiming here for is the knee to go over the toes, tracking between the big toe and that second toe. So that line between the big and second toe, that's where our knee is tracking forward for. Now, 2 to 4 inches past the toe is acceptable range. 4 inches plus is optimal. And once again, if we have an asymmetry on either side, we want to make sure we sort that out with the mobility provided or referring ourselves out. So we're simply going to keep our heel in contact with the floor, and we're going to push our knee forward as far as we can. We're going to mark that vertically with the dowel and then come out of the movement. Now, as we do this more and more, we may be able to grab range because this is actually a mobility stretch. So what we want to do is do it as few times as possible to get a true reading, and then we can mark one side, which is about 3 to 3.5 inches here, maybe 4, depending. We don't have anything to measure it here, but a guesstimation is fine. And then we switch our sides and we look at that exact measurement. Once again, on this left side, same range, I'm perfectly symmetrical here. You can line up onto a line to know how far you push that knee forward, so then you've got an even measurement on both sides. But like I said, we're looking for asymmetries, and we're also looking for sub-acceptable range of less than 2 inches here. Running, jumping, burpees, bounding, anything that involves an explosive lower body movement is going to involve your calves. Now, if you run a lot, you might find you get tight either in your calves or your anterior tibialis, which is that muscle beside your shin bone. Here's a calf release and an antib release that will help keep the tension out of that lower limb to help you put more Ks in your legs or keep you moving better for longer. So let's start with the antib because we're here. What we're going to do is clasp that ball with our fingers interlocked like so, and we're going to drag this ball up the leg until we find a little sore spot. Once we find that spot, we're going to pull that ball into that sore spot, and we're simply going to breathe. If that's not causing too much discomfort, we're going to raise that leg up off the ground, which is where you might feel most of that tension now. And from there, we're keeping the tension on the ball pulled into our antib there, and we're going to conduct some foot circles. So 4 foot circles one way and 4 foot circles other way. If you've got some pretty old ankles from wear and tear, i.e. sprains, strains and things like that, if they start to crackle and pop, don't worry. If there's a bit of pain, we probably need to go and see someone. Now, once we do our foot circles one way and foot circles the other, we're going to bring our foot back. So we're going to bring those toes back as far as we can, and we're going to let that foot drop. So no control over this. We're simply letting our foot slap down to the bottom there. And we're going to do 4 of those. Once we complete that, we can go back into our foot circles and then our foot drops as many times as we need until we feel that loosen up or we get a bit of improvement there. Things you can do straight after this is test your ankle mobility. If you do your antib release and you've got ankle mobility issues, test that range. Hopefully we've gone into either 2 to 4 inches of acceptable range of motion or 4+ if we can get there. But you should test after you do these types of things to know if it's moved the needle, particularly if you are looking to improve your performance. All right, now comes our calf release. The big things to remember with your calf, you have a lateral and a medial aspect. The lateral is the outside, the medial is the inside, and then you've also got a center line on your calf. So you want to hit all 3 positions when you're doing this release. Now, if you've got a yoga block, you can put the ball on top of the yoga block, but if you're bootstrapped and you're only using a ball, this is how you do your calf release. So if we compress our calf, i.e. we push into it and we find the widest part of our calf. Now, once we find the widest part of our calf as we look at it, we're simply going to put the ball underneath the widest part of our calf and we're going to put it on the floor here. To add the extra weight to make sure we get the right trigger point release in there, we're going to bring this foot up and on top of it. That adds a bit of direct pressure down onto the calf and allows us to get more traction when we want to release the calf. Now from here, we're in the center line. We're going to do those foot circles we talked about with the anterior tibialis release. We're going to foot circles one way. If you fall off the ball, that's okay. Just fix yourself. Foot circles the other. So that's 4 foot circles the other way. And then we go into those foot drops. So don't forget to wriggle around and try and find those trigger points as well. And then once we do the center line, we're going to move out onto the lateral aspect by rotating our toes outward. So we're going to conduct those foot circles once we find that trigger point, 4 one way, 4 the other, and we're going to do the foot drops here. Okay, once we do the lateral aspect, we're going to internally rotate that hip again and go onto the inside or the medial aspect of our calf. So the foot comes back on, foot circles, both ways, and then we do our foot drops. So we can do this as much as we want across either line. You might find you might be tighter internally, so the medial or the lateral. I spend more time there. I would spend more time on the bits that are more tender than the others to make sure you even out that calf. And like I said, make sure you test your ankle range or ankle mobility after you do it. If you've got problems in your squat like local front knee pain or anything like that, do your antib release, do your calf release, retest your squat and see if there's any improvement there. We spend so much of our days on these 2 little things right here. Now, we talk about trigger point, we look at our quads, our pecs, our lats, all that sort of stuff, all of these muscles. But do we neglect our feet? Here's a foot release that you can use when you are running, squatting, deadlifting, or doing any type of lower body movement. And it's also great if you're in a sedentary standing position for your work job. Having the blood flow through the base of the foot and through the fascia is a really important part to moving well and releasing those restrictions when we see ankle restrictions or limitations in our squat. So let's have a look at it. We've got a ball on the floor and we're going to stand on it. That's pretty much as simple as it is. So all we're going to do now is go searching for these little trigger points around our foot. And when we hit one, we're going to squeeze our toes like we're trying to pick the ball up. And we're going to roll out that foot. So if you feel a trigger point there, you're going to spend some time on it. You can try and stamp out the cigarette on the floor. So by pivoting on the ball, you can roll across it like a cross friction. And you can spend your time rolling out those trigger points at the base of your foot. Now, a really interesting test you can do straight after this is your ankle mobility test. If you feel like you have limitations there and limited range, you can do your foot release and test, and you might find releasing some of that tension in your feet increases your range of motion. So once you're there, squeezing the toes like you're trying to pick the ball up, putting out the cigarette or cross frictions across that ball, spend some time releasing those feet and they will thank you for it. Now, this is all directly related to ankle mobility and also that trigger point release we did for our feet. Sitting here for 2 to 3 minutes with our toes pulled underneath ourselves. This is one version of our sitting drill. Sitting here for 2 to 3 minutes, knees are together. This might actually be quite uncomfortable for some people. So we want to move up the time span if we need to. If we can only get 30 seconds out, come in for 2 or 3 more efforts after that. And we're going to sit here. This allows just that tissue to lengthen on the bottom of our feet to allow our proprioception to be as good as possible when we're in that squat pattern. Sitting here 2 to 3 minutes, sitting on our feet for 2 to 3 minutes. Now, if we've got really jacked up or messed up ankle joints, this might be uncomfortable as well. So we want to be barefoot so our shoes don't get in the way, but we also want to be able to take a bit of tension off by raising up off with our hands if we're starting to find that's painful. We don't want to push into pain. The trick with mobilizing your pattern, you need to feel safe enough to allow those muscle spindles to relax. Now, we're here for 2 to 3 minutes. They're your sitting drills. Now, with all of these that we're teaching you, you pick the ones that work for you. If these ones are stiff and tight or they're going to need work, you put these in your warm-up. If they're easy, you might want to move on to something else. Ankle mobility. In our squat pattern, we absolutely need it to have an effective squat movement. Now, you've learnt about ankle mobility and what the optimal and acceptable ranges are, 2 to 4 inches being acceptable and 4 inches plus being optimal. But I'm going to take you through a quick mobility exercise to make sure you're hitting those dorsiflexion ankle mobility limits so you can optimize your squat pattern. So we're going to be in that half kneeling position. This is very much like the way we tested it, but we're going to use our hands to manipulate some weight and some positional elements to make sure we can push right into that ankle joint to make sure we get the most out of this mobility stretch. Now, we're going to put a bit of weight on top of our knee. That's going to cause compression in the ankle joint, and we're going to keep that hand on the back of the heel, and that's going to stop that heel peeling up off the floor. Now, remembering through our ankle mobility screen, we want that knee to travel over the line between the big toe and the second toe. So we're simply going to be pushing into that range without that heel popping up, pushing down onto our knee as we go through the movement, making sure you're not letting that ankle peel up. Now we can get in there, we can sit in here, really push our heel into the floor, and then drag that movement back. We're going to go here for 2 to 3 minutes each side. Now what we want to do is test before you start and test at the finish and know how much this has improved. Remembering you can start on a line so you know how far to measure forward. You can use things like a ruler, measuring tape to measure how far forward or how much range you have, and make sure you keep an eye on those asymmetries, i.e. that uneven side, to make sure you're working on the less optimal side or side with the most restricted range enough to get it close to even or as best possible. And if you can't do it yourself, make sure you refer yourself out for someone to take a look at it, maybe add some manual therapy to help you along your way.